Hi, I'm Christina Cusimano, Senior Vice President of Marketing at AGS Health. And I have the privilege today of sitting here with Deb Stahl, our Senior Vice President of Transitions, to talk about denials management and the trends and more. So thank you, Deb, for being with us today. We really appreciate it.
Thanks for having me.
So, Deb, what are some of the most significant trends that you've seen as of late in denials management?
Payers are really getting creative with how they, deny new types of claims. And most recently, they use similar technology that we're building on their end too. But however, the clinical denials are getting more complex, and it really truly does. Providers are wanting to use, physicians, clinicians to resolve those clinical denials. So we're seeing a lot of that from a payer perspective. Now, AGS, of course, we have lots of resources to handle those types of denials, but that's some of the things I've seen. I've been in this business for 40 years, and I've seen it all. But the most recent trends I've seen are some of the AI platforms that they use on the payer side, which are similar to what we're building to combat that. So it's quite interesting watching what's happened over the last several years.
So Deb, can you tell us a little bit about how payers have changed over the past few years? What are some of the trends that you've been seeing with the payer changes?
Yeah, as we mentioned earlier, I think that payers have improved their technology. They're creating some of the same things that we are in AI, taking some of the decision making from the human aspect out of managing claims from an adjudication perspective, but also RPA, bots, things like that. So they're able to handle a lot more volume. Payers struggled with lack of resources in the past, just like the providers did, which is why they outsource, right? But with technology and some of the changes that we're seeing, I think AI is going to take some of the decision making out of the human labor side of things and be able to resolve large quantity and large volumes of claims on the payer side.
So Deb, can you tell us a little bit about how well do provider organizations typically understand the root causes of their denials? Tell us a little bit about that.
I think providers have gotten much better at identifying root causes and creating a denial management denial avoidance program within their organizations, especially large healthcare organizations, where they involve every department, patient access, health information management, patient financial services, and they're all part of identifying root causes and even involving the departments themselves, the clinical departments, where they sit down with these heads of departments and go through a report to say, here are the trends we're seeing, here's what we need to do to avoid those in the future. So that's been a trend in the past, I think. Now today, I think they're able to manage denials from an automated perspective through vendors like us, creating really creative ways to manage denials in bulk, and how we identify denials and resolve those, sit down with the payers in bulk instead of one by one. So we've gotten a lot smarter with the way that we handle and manage for denials for our customers, but also providers have also done the same thing on their end. Providers have also gotten used to using key performance indicators to measure denials, and using technology to do that as well, and trying to stay below the KPI or key performance indicator of 3% of net revenue or less, I think is very important. So they really, the map keys, the HFMA map keys, they really have adopted. But now a lot of that is automated through analytics tools, and we also can provide that from the AGS side.
So Deb, can you tell us a little bit about how automation and AI are changing the way healthcare organizations approach denials remediation?
Yeah, I think providers are constantly looking for ways to save costs, and they continue to struggle with cost management. Denial management is very expensive. And if it's not avoided from the very beginning, it causes a lot of rework, a lot of cost. But I think denial management automation has been around for a long time, but it's improved a lot with AI, taking some of the decision making out of denial management, Also digital workers and bots that are able to go into the patient accounting system, identify missing information. In the past, I think, just with claim scrubbing and things like that if a field was missing, then the claim would get denied. Nowadays, the technology's there, and we have the technology to go into a patient accounting system, identify a missing authorization number, pop it back into where it needs to go in a claim and rebill it automatically without human intervention, which is different than the way it used to be. With missing fields in the past, it was just denied, and you'd have to go find it manually, enter it in, rebill the claim. That's all a thing of the past. Also, denial management has become more sophisticated from the provider side in that we're able to, work by types of denials, by bulk, by identifying ways to submit claims in bulk and resolve large quantities of those denials on behalf of our customers. But AI and RPA has really changed things for denial management.
It's fascinating what AI has done for our customers in every aspect of the revenue cycle. So
Absolutely.
Thank you for that. So Deb, one last question for you. How should organizations balance resources between high dollar versus low dollar denials? Can you tell us a little bit about that in your perspective?
Sure, and times have changed. In the past, we used to have a high dollar team and a low dollar team working the claims one by one manually. And providers tend to focus on the high dollars because it costs the same amount of money to work one claim as it does a lower dollar claim, regardless of the effort that you're putting into it. However, automation has truly changed that, where outsourcing low dollar claims to a vendor like AGS Health, we're able to automate a lot of that ourselves and save costs on behalf of our customers, and also save costs for us, where we can actually work in bulk, work a lot of those claims in sheer volume instead of having to work them one by one. I call it segmentation, where we look at different types of denials and working on what the type of denial is, and specializing our teams by denials has also been a best practice that we've learned to do in the past.
Well, that's great. Thank you so much for sharing your perspectives on denials management, the trends that are happening, remediation, and all things denials. Very, very informative. Thank you so much, Deb. We really appreciate it.
Thank you.